happy evening, a very good evening. I hope and I believe all of you are doing well. Quick note whether the audio visual is all good. All right, so welcome to the episode 69 of NF100. Now, what is NF100? Before anybody asks me, NF100 is basically the NEET PG and FMGE top 100 topics. And this is episode 69 is where we have reached. And today we are going to discuss the topic of spirometry. Now, why spirometry are we discussing today is basically because in our daily targets, the new timetable that we have started for you to follow. So we have respiratory physiology and cardiovascular physiology. So we have already done the cardiac cycle and Bigger's diagram today evening. So now we are doing respiratory physiology, that is spirometry. The plan for tomorrow, it's basically going to be tomorrow we will be having another sessions at 5 p.m. and 8 p.m. 8 p.m. is going to be the special class on the Unacademy app. Special class is basically a free class. It might ask you to use a code. You can use the code Dr. Nikita Live or Dr. Nikita. And the plan for tomorrow is 5 p.m. Basically, we will see the integration of Bigger and the pressure volume loop, taking into consideration the valvular lesions of the heart. How the pressure volume loop is basically you interpret and how it changes in the various valvular lesions, aortic stenosis, mitral stenosis, all of that. So basically the important graphs from the first aid book as well. And 8 p.m. we will see the respiratory physiology ke graphs. Okay. So what are the important graphs in respiratory physiology? If there are some important calculations that we should be knowing. So this is very, very important. The graphs, the flow volume loops, all of that we will be seeing tomorrow 8 p.m. right? So this is the plan for tomorrow 5 p.m. and 8 p.m. Okay, 5 p.m. and 8 p.m. Before we move ahead, let me tell you about the iconic subscription, that is Unacademy with Prep Ladder. And till tomorrow only we have this offer, that is basically if you take a 4-month subscription, you'll get 1 month extra. If you're preparing for the December-January exams, I think this is the best time to buy the subscription so that you get 1 month at no extra cost. And we have also started yesterday with the FMG comprehensive batch, where we discuss all the subjects in details for students who find a recorded thing difficult. You can definitely join in for this live interactive batch, and we have had some great results in the FMG June 2022. Apart from that, we have the NEET PG Med Scholar Grand Test. If you want to take a subscription for free, this is the best time. Give the Grand Test, get great ranks, and get the subscription for free. It is on July 17 at 9 a.m. Again, if asked for the code, you can use the code Dr. Nikita. Okay, Kani, stay connected on the Telegram group as well, where I keep you posted of all the sessions that I take on a daily basis. Right? The NEET PG students who basically want to practice a lot of MCQs can join the live TND batch, where you practice each MCQ with an educator. So basically we'll have test and discussion. And then after October, the last 2 months, we will have the high yield revision. So anybody who finds it difficult to do self-study, these live batches are the best for you. So either you can take Plus, Iconic, or the Light subscription, that is only the test series, and MBBS Prof 1 subscription and CMS subscription as well. All right. So let's start like always. The first assessment question here. Let me see how many of you get this right. Vital capacity is sum of which of the following? What do you think is the answer to this? Right, so we are going to talk about spirometry today, the measurement of the lung volumes and the lung capacities, what can be measured, what cannot be measured. So who's getting this right? The first, great. Swati, Kamran, Dr. Mini, absolutely right. The answer here basically is the option A. Okay, the answer is A. Why the answer is A? I'll come back to this question once we discuss the theory part of it. Right, here you need to use the cheat code, very, very important, that is ruling out the options. If you rule out, you'll automatically come to the answer here, that is A. Now, what do you rule out? Let's learn the concept here, then we'll come back to this question. Right, so please start answering. I have described each of these volumes here. We have 4 volumes, we have 4 capacities. So tell me, what is the first volume describing? The amount of air that moves into the lungs with each inspiration or that moves out with each expiration. Very, very important during the quiet breathing is which of the following? What volume is it? So remember, jab hum shanti se, there's a quiet breathing that is going on. No extra efforts is what we are putting. So that is called a tidal volume, right? So understand the terminologies. Remember these terminologies. Tidal volume, tide. एक normal tide chalta rahega. We are not talking about high tide or low tide. We are just talking about the tide of respiration. Inspiration, expiration, inspiration, expiration. So basically, during the quiet breathing, what comes in or what goes out, that is the tidal volume, right? That's the tidal volume. The next one, the air inspired with a maximal inspiratory effort in excess of the tidal volume. So now we are saying during quiet breathing, we breathe in tidal volume. But we do have some extra reserve volume that we can inhale if we want to, if we put in some extra efforts, right? So basically, it's like daily I study for 4 hours, but if I want, I can put in extra efforts and I can put in more data into my brain. I can study for more 2 hours. So that extra reserve of 2 hours that we have, that is the reserve volume. That is the inspiratory reserve volume. Okay, that's the reserve that I have. So this is inspiratory reserve. I've kept it as a reserve. If I feel like, I'll do. Otherwise, normally I will not do it. Next, the volume expelled by an active expiratory effort after the passive expiration. So the passive expiration has gone. Tidal volume has gone. Over and above that, I have a reserve volume that I can exhale. So that is the expiratory reserve volume, right? So like you have inspiratory reserve volume, we have expiratory reserve volume as well. And the air left in the lungs after a maximal expiratory effort. Okay, look at the point very, very clearly. Maximum effort I've put in. Now what is left in the lungs after the maximum effort? That is, what is left after the maximum? Left is basically residual. Residual basically is left, right? So that is the residual volume. Please do not confuse it with functional residual capacity. There are 2 terminologies where you have the term residual. As the residual tells you that it is remaining in the lungs after breathing out. Now, breathing out can be either quiet or it can be with effort. So the amount that remains in the lungs after the quiet expiration, effortless, that is the functional residual capacity. Remember, functional matlab normal. Functional matlab normally. So normally with the quiet breathing, what remains? That is the functional residual capacity. What remains after maximum expiration? That is the residual volume. Now, what is the difference between lung volume and lung capacity? Capacity, when we say a lung capacity, is basically a measurement of 2 or a sum of 2 or more volumes. It is the sum of 2 or more volumes, right? Absolutely, Bharti and Asmita correct. So remember, residual volume is residual even after maximum expiratory effort. Now, this is a table that we have completed. So basically, the first one, tidal, is the quiet breathing. Inspiratory reserve volume is in excess of the tidal volume. Expiratory reserve is after, that means in excess of the tidal volume, and residual volume is after maximal expiratory effort. Now, how do we remember these values? If you want to remember these values, we can do that as well. I'll tell you how to remember the values. once you see the graph. First, let us come to describing the capacities. What is this first capacity which is described here? So we said that there are 4 volumes that we have, right? There are 4 volumes and there are 4 capacities. When you add all the 4 volumes that we saw, the TV, the IRV, the ERV and the RV, basically all the 4 volumes is total. So this is the total lung capacity. Sum of all the 4 is TLC, right? Now from this TLC, what are you removing in the second capacity? What is not included? The RV is not included. So IRV, TV, ERV, everything is included, but the residual volume is not included. So what capacity is this? All the volumes except the residual volume, basically which is remaining in the lung even after maximum effort. It is not coming out, basically not participating in exchange. So this is the vital capacity. Now how do you remember vital capacity? Check the vitals. It's only for a person who's live. So vital is basically for the live volumes, the volumes which are participating in exchange, be it with quiet breathing, that is TV, or with effort, that is IRV and ERV. Residual is not participating in exchange. So it is not included in vital. Okay, remember that. So that is why remember that residual volume cannot be measured with spirometry. You need to do the whole body plethysmography because it's not coming out. Spirometry only measures what is participating in the exchange. So residual volume does not, it's not possible to be measured by spirometry. TV plus IRV, normal जो अंदर जा रहा है plus excess जो अंदर जा रहा है. So this is the total inspiratory capacity. When I say capacity, it's the sum of minimum 2 volumes. So inspiratory capacity is TV plus IRV. TV plus ERV is expiratory capacity, and ERV plus RV, that is your residual volume which is there, right? ERV plus RV, this is basically remaining in the lungs. ERV plus RV remains in the lungs after normal expiration of forceful, after normal expiration, effortless. So this is functional residual capacity. Okay, the residual capacity is the sum of 2 volumes that you have, the expiratory reserve volume and the residual volume. Okay, and the residual volume. Okay, so these are the 4 capacities that we have. Now, going to this graph, give me a minute so that we go to this graph. Okay, so this is the graph that we have. Tell me, I have labeled these, the images here. Let's label this as A, B, C, D, right? And then you have E, F, G. Okay, let's say this, and then you have H. Let's label this as H. Now look at this graph. So basically it is showing the volume, right? It's showing the volume here. Look at this one. Okay, so these lines are basically the quiet breathing wala. So this one, that is this normal wala, this is B is representing what? What is this B representing? Which is coming in, going out, coming in, going out. Basically the upward is the inhalation, the inspiration. What is the B representing, which is happening with the normal tide? That is the tidal volume, right? The quiet breathing is the tidal volume. Okay, the quiet breathing is the tidal volume. Okay, now tell me, what is A representing here? What is A representing? Now, what is A here? A is from this value to this value. So basically, this is the A here. Okay, from this value to this value is what is A. Absolutely right. So this is also just one volume. This is not a capacity. So this is the inspiratory reserve volume, right? Now which of these represents the inspiratory capacity? Which of these alphabets A, B, C, D, E, F, G, H? Which of these represents the inspiratory capacity? That is the maximum that I can inspire or inhale. So that's going to be a capacity. That's the sum of two volumes. So which one? So this is the inspiration and this is the inspiration here. So the sum of these volumes, that is basically the tidal volume and the IRV. So this one is going to be which one? Are you sure it's E? Absolutely right. So basically this is A plus B. The none of the alphabets here is basically showing your inspiratory capacity. So this is going to be your inspiratory capacity here. Okay, this is going to be inspiratory capacity A plus B. Right. Now going to the next one. Okay, let's identify this. What do you think is this representing? What do you think is this representing? Give me a minute. All right. Yes. So this one, what is this representing? Basically, it is this part that we are seeing here. So this is the amount of air that is going out. Downward is the one which is going out. So this is the amount of air which is going out. Normally, it is not going out in the tidal volume, in the quiet breathing. But I have this extra reserve that I can send out. So that is the reserve for expiration. So this is the expiratory reserve volume. Okay, this is the expiratory reserve volume, right? What is this volume here? So basically, in this part, what are we seeing? Like, look at this part. This is the part where you don't see any line. So it means that it's not participating in the exchange, right? So there is no exchange which is occurring in this part, irrespective of the maximum effort also, right? Even after maximum effort, it is not going out. So that is the residual volume, okay, which remains in the lungs after maximum expiration also. No matter how much efforts you take, it's not going to go out. So that is the residual volume, right? So this is the TV, this is the ERV, RV, and this is the IRV. Okay, this is the IRV. Now let's identify this one. Okay, what is this representing? Let's see the next one here. What do you think is this representing? So now whenever you are seeing that it is including two volumes, it is basically including this volume and it is including this volume. So what is this volume? It is remaining in the lungs after normal expiration. So that is FRC, right? Functional residual capacity, sum of two volumes. Basically the ERV and the RV is what forms the functional residual capacity, right? That's the functional residual capacity. Next one, what do you think is this here? Okay, so this one basically, okay, from here to here. So what are you seeing? Everything is included from this part to this part. Everything is included except the residual volume. Except residual volume, residual excluded, that is the vital capacity. It is the part which is participating in the exchange. It is live. Vital is live. So everything except the RV, that is the vital capacity. Okay. So if you are asked to measure the vital capacity, it is from here to here. Okay. It is the entire one which is here. That's the vital capacity. And the total that you see here, upar se niche, including residual volume, that is the TLC. Okay. That is the TLC. Clear with everyone? So let's see this graph here. So this is the tidal volume. This is the expiratory reserve, residual volume, FRC. You have IRV, vital capacities, everything excluding the residual volume. Okay. Now the next one. Okay, let's have, if I ask you this, let me zoom this image. All right. So I'm not able to zoom beyond this point. So if you are asked about this one here, okay, from this part, are you able to see the cursor? I need to see that. Yes, you are able to see this. So this part from the above line to this line, if I ask you what is this representing, this is basically the IRV plus the TV. So this is the inspiratory capacity. Okay, this is the inspiratory capacity. Absolutely right. So now if I tell you that TLC is equal to inspiratory capacity plus the functional residual capacity, tell me whether this is true or false. Is this true or is this false? Total lung capacity is inspiratory capacity plus FRC. Is this true or is this false? Yes, absolutely right. So, see, inspiratory capacity is IRV plus TV. Functional residual capacity is ERV plus RV. So, all the four volumes are here, right? All the four volumes are here. So, that is why it is TLC. Now, next, if I ask you, what is inspiratory capacity plus ERV equal to what? Inspiratory capacity, that is, visualize a graph when you are answering such questions. Inspiratory capacity यानी IRV, TV plus ERV. What does that mean? It is equal to what? Inspiratory capacity plus ERV is equal to what? Absolutely right. So this is the vital capacity. So basically you have IRV plus TV plus ERV. Everything is there except the residual volume. So that is the vital capacity. So great. I hope all of you have got this. Now let's try solving some questions here. These are the questions. Tell me quickly. Volume of air taken in and given out during normal respiration is referred to as what? Right, it is during normal respiration in and out. It's like a tide. So that is tidal volume. Okay, that is tidal volume, which comes in and which goes out. That is tidal volume. Okay, that's tidal volume. And before we discuss, we said that let's remember that let's try to remember the volumes. Okay, the number also कि TV कितना है, IRV कितना है, ERV कितना है और residual volume कितना है. If you remember the four volumes, then out of that you can derive any capacity. Now look at the graph. Have this visual memory in your minds for the spirometry. The tidal capacity, take it as 0.5 liters, that is 500 ml. Let's take the round figures. Right. Now this is the tidal volume, which is sabka number, chota number. Then you have this ERV and RV, which are almost of the same length, right? The same thickness. And they look the double of the TV. So this is like 1 liter and this is 1 liter. So ERV or RV, 1 liter, 1 liter. सबसे ज्यादा जो दिख रहा है यहाँ पे वॉल्यूम, the high is the which has the maximum height, that is the IRV. So this IRV, imagine that the reserve to take in that we have is 6 times of the normal. So 0.5 into 6, that's approximately 3 liters. Okay, that is approximately 3 liters that we have. So take it at the round figures, right? So to remember this, remember that TV is 0.5, ERV or RV is double of it, that is 1 liters, and IRV is 6 times of the tidal, that is the 3 liters. Okay, that's the 3 liters. So now if you see this capacities ka number, ठीक है. If I ask you vital capacity कितना है, तो let's see IRV 3 हो गया, ये 0.5 हो गया, ये 1 हो गया, so that is 4.5 liters. Okay, that is 4.5. Inspiratory capacity is 0.5 plus 3, that is 3.5, right? That is 3.5. So this is how you can remember the values. So remember 0.5, 1, 1, and it is 3. That is what you need to remember here. All right, so IRV is the maximum. Okay, let's go to the next one. We have discussed this already. Spirometry can demonstrate and measure all of the following except, so everything participating in the exchange except, what is going to be the answer? Residual volume, right? It cannot measure the residual volume. Can it measure the vital capacity? Yes, it can, because vital capacity is everything except the residual volume. Okay, it's everything except the residual volume. Next one. By solving this question, let's see who gets it right the first. So such are the calculations that are asked. Unnecessary extra information is also given, basically to confuse the students. Absolutely right. Yes, dear Angel, very correct. This is D. ठीक है, इसको कैसे solve करना है देखो. First, in calculations, numericals always see that what has been asked to calculate, right? To calculate is the ERV. What has been given is the vital capacity, right? Idle volume has been given, inspiratory capacity has been given, and FRC has been given. Now we are asked to calculate the ERV. See, vital capacity is given, inspiratory capacity is given. What is vital capacity equal to? The three volumes except RV, that is TV plus IRV plus ERV. What is TV plus IRV equal to? It is inspiratory capacity. So basically it is inspiratory capacity plus the ERV. Both of these have been given. Vital capacity is 5. Inspiratory capacity is 3.5. So basically the ERV would be 1.5. 5 minus 3.5, that is 1.5. Okay, the answer will be 1.5. Is this clear with everyone? Try to put in the formulas right based on what has been given. Okay, based on what has been given. Okay. If I ask you what is the total lung capacity of this patient, what is the total lung capacity, then what will be the answer? Next time the question has been changed to calculate the total lung capacity. Very good. Sagala Charan, absolutely right. It's gonna be 6 liters. Now understand this again. Total lung capacity is basically your which two capacities together? We discussed this. Inspiratory capacity plus the functional residual capacity, right? So that is inspiratory capacity TV plus IRV. FRC is ERV plus RV. So all the 4 volumes have been included. IC inspiratory capacity given is 3.5. FRC is given 2.5. So 3.5 plus 2.5, that is basically 6 liters, right? So remember this as well. TLC is IC plus FRC. Vital capacity is IC plus, from the FRC remove the RV. So you only have the ERV. Okay, so these are another important formulae that we had discussed. Okay, remember this. Okay, next one, let's go to the next question. Which of the following lung volumes can be measured by the spirometry? What happened to the live chat? Give me a minute. Absolutely right. Very good. What can be measured by spirometry? So whenever you get this question, what can be measured, what cannot be measured, just remember that residual volume cannot be measured. Now, residual volume is a component of functional residual capacity, which in turn is a component of total lung capacity. So these are the ones which cannot be measured. So FRC, RV, TLC cannot be measured. Now you have dead space and you have vital capacity. Dead space again does not participate in exchange, so spirometry mein nahi hoga. So that's going to be vital capacity. So basically whatever is live and participating in exchange, the vital capacity will be measured because it is all the volumes except the RV. This is what you need to remember. Okay. Next one. What do you think is the answer to this one? Which volume remains in the lungs after a maximum expiration? Which volume remains in the lungs after a maximal expiration? It is talking about maximum. That means it is not participating in the exchange. So the answer is going to be residual volume. If I talk about after the normal expiration, then it's gonna be the FRC. Okay, after the normal expiration, it's FRC. So FRC is ERV plus the RV, right? It's the ERV plus the RV. Next one. So this is a question that I had asked you in the beginning of the class. So I hope now all of you will get this. So whenever you get question like this, vital capacity is sum of which three volumes? So what you only need to remember is vital capacity is everything except the RV. So residual volume should not be there. So if you see residual volume, residual volume, residual volume, these options are ruled out. So automatically the answer becomes A. It's IRV plus TV plus the ERV, right? You have the IRV, TV and the ERV. So you have the tidal volume, the IRV and the ERV, that is the vital capacity. The residual volume is not included. Okay, I hope everybody is now clear with this. Okay? Which volume remains in the lungs after a tidal volume is expired? Which volume remains after the tidal volume is expired? So basically you have this ki tidal volume expire hua. So what remains in the lungs is ERV plus RV, that is the FRC. Tidal expiration is basically the normal quiet expiration or respiration. Okay, so the answer will be functional residual capacity. Absolutely right. It's gonna be FRC. Okay, it's FRC. Functional residual capacity is defined as, what do you think is the answer to this? Functional residual capacity of lung is defined as, read the question very carefully. I can see many of you making silly mistakes here. That is how the examiner tries to trap us. For whoever answered A, the answer is not A. The A is saying it is volume expired after normal expiration, while FRC is volume remaining after normal expiration. So read it very, very carefully. So, right, this is how we make silly mistakes. So it's not the volume expired, it's the volume remaining after normal expiration. So A is out. Volume remaining after forced expiration is residual volume. ERV plus RV, right? जो भी tidal volume के यहाँ पे नीचे है, that is the functional residual capacity. Tidal volume plus the volume inspired forcefully is the inspiratory capacity. That's the total inspiratory capacity, right? So silly mistakes, this is what is the lesson learned here. That is how, that's why I always say that no matter how much theory you read, until and unless you practice MCQs, you will not know ki where are we making the mistakes, be it silly mistakes. Okay, so ऐसे ही बस English के grammar में also examiner can trap us, right? So this is about your so So Madhav, do not go by this, which volume remains in the lungs after tidal volume is expired. The answer is functional residual capacity, which is basically the sum of two volumes. No other thing fits into this, right? The definition is of functional residual capacity itself. So that's like a very, very diligent checking of the grammar and the formation of the question, Madhav. That's good. Okay. So I hope the topic of spirometry, especially the graph, remembering the values 0.5, 1, 1 and 3, it's clear. The graph is clear. RV is not measured by spirometry. That's clear. These are the some of the important points that you should know. So, whenever you read a particular topic, try to get a gist out of it. Try to solve the question. See about what fact or concept the questions are revolving in that topic. Okay. So that was for today, guys. When are we meeting next? Tomorrow, 5 p.m. and 8 p.m. 5 p.m. it is physiology, medicine integrated for Wiggers diagram and the pressure volume loop. Very, very important, especially for the NICT exam. And 8 p.m. will be the KBMD session on the app, which will be for respiratory physiology graphs and the numericals. Okay, the respiratory physiology graphs. Very, very important, right? So thank you so much, everyone, and goodbye. Take care and keep studying, keep revising, and keep winning. Thank you so much. Yes, Bratadiva, the SWM Study With Me session will be there at 11:30 a.m. Okay, at 11:30 a.m. Okay?